maybe now it's working. I hope it's working. Do a quick little test run here and check the audio. Do a quick little test run here and check the audio. Do a quick little test run here and check the audio. Whoa, that was weird. Okay, I think it's working. Bear with me for just a moment here. I'm trying to just figure this out. I normally would stream on my phone, but because I am not special, I'm not special enough, I cannot stream from my phone anymore. So I have to do it from my computer. Luckily, I actually have this cool setup where I can use my phone camera into my computer and stream that way. So I have my phone set up right now. I decided not to get too technical with the mic. I was gonna set up my my studio mic, but I just decided not to. It says you need to change the video resolution. Your current resolution is, which is not supported. The expected is 1280. I thought it was. I mean, it should be good. I'm thinking it might be good. My only issue now is the chat. Okay, before we even get started with this quick little video here, I don't know if I think it shows one watching. I don't really know. If anybody's watching, if you could please just in the chat give me a thumbs up. Let me know how the audio sounds. I don't want to hit the audio thing on my computer and mess anything up. I know the quality's probably not like super great, but I guess as long as you can hear me, if someone could please just give me like a thumbs up or an okay. I'm pretty sure the chat should show up right over here. Shows the stream health. I mean, I'm watching myself, so I mean, I think it might be all right. I don't know. I guess we're just gonna have to go with it. Let me actually see real quick. Maybe I don't know. I guess we're just gonna have to go with. Yeah, I think it's working. Okay. So, wow, it's been a very long time since I've showed my face on here. Did it freeze? No, we're good. Okay. So anyways, my name is Brandon, aka Broken Ocean, and so I've posted some quick little streams, you know, maybe like a month or two ago, slightly touching on the shit that I've been dealing with, and you know, it's not necessarily gone downhill, but just, you know, the last couple months have been like a roller coaster, up and down, and there's just so much shit going on. In short, you know, I have macular degeneration, which basically, for those of you that don't know what it is, it's normally like an age-related thing that people in their 50s or 60s, even older, get due to age, and essentially it affects the macula and the retina, which obviously is you know, the most important part of the eye. I'm gonna try to get more centered here. It's backwards, so that's weird. So yeah, anyways, it affects your center. I mean, the retina is, you know, the most important part of your eye, pretty much. And, you know, the macula is responsible for your center vision. So basically, normally people just get this, it's called age-related macular degeneration, and normally people get it due to age, obviously a lot older, like 50, 60 years old, maybe even more than that, older than that, I should say. And, yeah, I mean, there isn't a necessary cure for it, but there's treatment to kind of help it. And, with age-related, it's tricky. You know, I mean, you know, they can give, you know, treatment to kind of help it, but, I guess once you get it with due to age, it's a completely different thing. But what I have is, it's basically, the technical term would be myopic macular degeneration. Obviously, I'm only 26 years old, so I did not get it due to age. The reason I got it is because of my nearsightedness, as you can probably tell, because my glasses these are thick, these are very old, but they're, my eyesight, I'm very nearsighted. So obviously, just with being super nearsighted, there's a lot of risks once you get past -6, which truthfully -6 isn't all that bad. Me, I'm like way past that. I think, I don't know for sure, but my contacts, which I don't wear anymore, but I got my contacts updated last year. My contacts were -16 and -14, I want to say, or -15. They're like one apart. I just went to the eye doctor to get new glasses maybe a couple weeks ago. I still haven't gotten them yet because it's a big process ordering them, but I think my glasses are like -19, I want to say, which normally, glasses, because they're not on your eye, they are typically stronger than contacts. So my eyes haven't really changed much, but that's just to kind of put it in perspective. And -6 is kind of like, okay, that's where we got to start watching. I'm -19, -20, somewhere around there. So, some people who are super myopic, nearsighted, some people maybe don't have issues like this. Some people could. I mean, it's very rare, but it's super possible. The big thing to watch out for when you're nearsighted is like retinal tears and retinal detachment, stuff like that. But in my case, I have macular degeneration, which essentially what happened. This all started back in February. Just literally, just like that, it just happened, and that's just what it does. It just happens. There's no like signs or symptoms. Like, you can't really detect it. It just like happens. And one day I was looking at my phone, and all of a sudden I noticed in my left eye that there was like squiggles or whatever. And then I was working on my computer in Ableton, which has like a lot of grids and stuff. And I noticed a lot of the lines, there was like a spot where it was just like squiggly. I let it go, and it kind of like went away. And then a week later, it came back, but it was like 10 times worse. So, stupid me, I should have went, like, literally the second I noticed it, but at that time, I was kind of almost, like, in denial, like, where, like, I was thinking, like, oh, I'm going to be fine, it's probably just something stupid. I Googled, like, oh, it could be, like, an ocular migraine, like, it's probably just nothing. But, I mean, maybe I should have went in a week earlier, I don't know if it would have made a difference. But I went in, and essentially, my eye doctor told me to see a retinal specialist. He said, basically, it looked like macular degeneration, and there was bleeding in my eye. So I went to the retinal specialist. They confirmed it was indeed macular degeneration. It was wet, which is the advanced version. And like I said, basically what that means, abnormal blood vessels essentially grew, and they broke through the retina or the macula, I believe. Or maybe they broke through the retina and leaked fluid into the macula. There's still kind of, a lot of it is hard for me to grasp. But long story short, there were abnormal blood vessels growing through my macula. And what had happened, they leaked blood into my eye somewhere. I don't know if it was necessarily in the fluid in my eye, but it was somewhere, in my eye, which caused a blind spot. So, after doing all that, they told me that there's a treatment for it, and I said, okay, let's do the treatment. Unfortunately, the treatment is an injection, and it's not an injection in your arm, it's not in your fucking leg, it's in your eye. So, they do treatment. There's a couple different types of medication, but basically the medication they put in your eye is an anti-VEGF. I forgot what it stands for, but it essentially, I know they give it to cancer patients, through an IV to retract blood vessels from tumors. So, I think it only works for like certain cancers and stuff. Maybe, I don't know. But essentially the mechanism, or the mechanics behind the medication is that it gets rid of abnormal blood vessels. So they inject it into the eye. So this was back in February. I got, I got the first injection, and I don't remember, a lot of these, a lot of this, the last couple months have been like a blur. It must just be like that kind of fight or flight response maybe type thing, like where you kind of block out certain things that are traumatic, and this was like a big thing for me. And it happened in the one eye, and I kind of was like, okay, like it took me like a while to get over. I got the first injection. I realized that the injection itself was not bad. Literally, like the actual injection from the time that, like, they had a, I'll get more into detail about this in a minute, but the injection itself literally took 5 seconds, maybe, if that. It was so quick. The prep work took a couple minutes, maybe like 15 minutes, because they had to numb my eye really good. But the actual injection, from the time he put the needle in and took it out and I got up and left, that was probably like 10 seconds. There was literally nothing to it. So I'll go through more of the procedure later. But yeah, so I got the injection, and now normally there's, every doctor is different and everyone has a different procedure, but the typical procedure is to do a series of injections to make sure that there's no bleeding, and then some doctors will just stop treatment and keep a close eye on it, or other doctors like mine will spread out the treatment. So normally I started doing 4 weeks, getting an injection every 4 weeks. So I got 3 injections 4 weeks apart. Luckily, after the first injection, there was a lot of improvement. And, my doctor was very pleased. I was very happy. When I heard that, it definitely made me feel a lot better, kind of put me at ease, and I kind of started living life again. And, so I got the second injection, got the third injection, and after the third injection, I still had a tiny blind spot in the center of my vision, which, I expected to probably be permanent just because it's scar tissue, but it wasn't really like that bad, and I was adapting, and it seemed to kind of like, I was okay with it, I guess. I kind of just accepted it, in life, unfortunately, everyone gets dealt a hand of cards, and some of them are good, some of them are bad. Unfortunately, bad shit happens, and you just, we as humans have to adapt. Good coffee. So anyways, after the third injection, out of nowhere, I got a spot in my right eye, which was my good eye. Now, this one wasn't the same. It was a little bit different. It was off to the side, and it wasn't as, like, distorted. It was just, like, it was a weird spot. So I freaked out, because that's my good eye. I went in, like, right away, seen the doctor, and he told me that it was just fluid. And I don't know the exact diagnosis, like all the terms and stuff, but from my understanding, what I understand that it is, there's something called like a lacquer crack, which is, I believe, maybe just like a tiny crack somewhere in the macula, the retina. I don't know, but basically, like, just a small amount of fluid, way different than this eye. This one actually was like swollen, filled with fluid, because of a crack, like, from abnormal blood vessels. Now, in this eye, there were no abnormal blood vessels. It was simply just, like, a bleed. And at the time, I was dealing with, like, a real bad respiratory infection, blowing my nose constantly, so supposedly it could have been caused by that, maybe. I'm not really too sure. But he told me it was nothing to worry about and that it would go away on its own. So, fast forward, a week later, the size started shrinking. At first, it looked like a jellyfish. It was a circle with just, like, it looked like, literally like if you were to take, like, a paintbrush with paint, splat it on the wall, you got the circle and then it drips. That's kind of what it looked like. And it was in my kind of, like, side lower vision, but it kind of went away. It got smaller. So I got super excited. I kind of was, like, okay with it. And then out of nowhere, it changed again. It wasn't super bad, but it got longer. And when these bleeds and all this stuff happens at first, especially if you go into like a panic mode, it seems a lot worse than it is. So anyways, so I went into the doctor, and he checked it again, and he told me he didn't really see like a difference in the picture. So this is a week before I had my next injection for this eye scheduled, so he just said, we'll check it next week when, we come in, which happened to be actually this past Friday. So this past Friday I had an appointment to get my 4th injection, which was the first injection that was 5 weeks apart. Well, the night before, wouldn't you fucking know, excuse my mouth, wouldn't you know, I got another spot in my eye. And it was a big old spot in the peripheral vision, looked like a bleed. So, of course, now I'm freaking out. I'm like, okay, so this is crazy. This is literally the day before my injection, and I got another spot in my eye. So, I go for my injection, I call my doctor, whatever, told me to just, come in. Or actually, no, I went to go see him. I seen a different guy. He wasn't really much help at all. I just said, I'm just going to wait till my appointment tomorrow, see my doctor. And I went in, got the injection, he looked at everything, and, supposedly it was just a new blood spot, which I guess happens. So there wasn't like abnormal blood vessels again, it was just like a bleed. And, typically that's what the medication is supposed to prevent. But my theory is that since it was the first 5 weeks apart, maybe it just happened, maybe I should have did 4 weeks, I don't really know. I mean, it wasn't anybody's fault, it just kind of happened. So I got the injection was fine, no problems. But when I was there, we were talking about my right eye. So he said he didn't really notice much of a difference, in that little tiny fluid spot that was like right on the line. It didn't break through, it was just little tiny fluid on like the actual macular retina, like right on the line, whatever the line is. I don't know all the little details and stuff, but basically there was just like a tiny little fluid spot, and he said it looked like it got a little bit bigger. He said it would go away, but me being kind of like paranoid, I'm like worried. I'm like, well, this is my good eye, what can we do, just in case. I was like, I don't want to have the same situation in my right eye. So, he explained that, we could do the injection. There's only like a 1 in 3,000 chance of an infection, which is probably, that's like worst case scenario. At first we said no to the injection, but then we talked some more, and we decided, you know what, let's do the injection, cover all bases, just to be on the safe side. And this whole past weekend I was freaking out, I was so nervous to do anything. I had the injection scheduled for yesterday. So this whole weekend, this past weekend, I was like literally just like glass. Like I was afraid to move, afraid to do anything. Sure enough, the day before, I got another spot in my left eye, which is my worst eye. This one wasn't really as bad, but it was up in my peripheral vision. I happened to actually get one the day after my injection, and that one was gone, and now there was one in the middle. So I don't know if they move around. I don't really know the details, but yesterday I went in. I did get my first injection in my right eye, which I'll go into details in a little bit. Basically, actually, I gotta do something too. I forgot to add tags to this. I want to try to get some people in here, hopefully. I know this is like kind of like not a super common thing, but my goal with these videos or these vlogs or streams is just to hopefully document everything and get some information out there, just so like anyone else who is like around my age. Like I said, I'm only 26 years old, and I'm part of a bunch of groups on Facebook, and I think the youngest person that I've like talked to is like 39, maybe a little bit younger than that, but it's not super common. I know I reached, I found a couple people on YouTube, someone who had like a similar issue, who was like a similar, close to my age. I think he had like a retina problem, and so I guess my thing is I just want to document this, get this out there, so hopefully it'll like help somebody else, maybe if there's anyone else going through this. I'm not really too sure, but let me... I don't want to screw this stream up. I had tags in here, but I am sure they are all related to music. Okay. Hopefully we're good. I totally forgot to do that. Not that it's like a big deal. But I had a bunch of music tags because the way YouTube streamed, like the last stream I did was like a live stream for music production. Anyways, so yeah, so we talked, we said we were going to do the injection in the right eye. I said just to be on the safe side. I really was afraid that, I just want to protect this eye. I want to protect both eyes, obviously, but just to be on the safe side. So anyways, we scheduled the injection for Tuesday, the day before I got another spot in my left eye. So, anyways, I had my first injection in my right eye yesterday. I was super nervous about it just because with the first injection in my left eye, the injection wasn't bad itself, but the aftermath sucked. And for 5 days, it literally felt like I got punched in the eye. And after doing some research and after getting the other injections were completely fine. Literally didn't feel a thing. One day, I was fine. I was good. What I've come to the conclusion, I've came to the conclusion that basically, because after I got this injection, the injection was fine. Aftermath, it sucks. I literally feel like I got punched in the eye. So the way they do the injection at my doctor, they give you the numbing drops in the eye, and then they stick this Q-tip with this super thick numbing gel. They stick it under your eyelid, you close your eye, and you sit there for 15-20 minutes, give or take. The Q-tip kept falling out, which I don't think that was a big deal. But after they do that, everything is like super quick from there. And basically, after they take the Q-tip out and clean your eye with something called betadine, they put the clamp in your eye. So, two things. Betadine is like a cleaner, and I know that can cause irritation. And my right eye has never got exposed to it. And it has also never been exposed to the trauma from the eye clamp. I know the eye clamp technically is supposed to be like gentle, but it's still a foreign object in your eye, and I mean that it's trauma to your eye. So my assumption is that first exposure to betadine, first eye clamp, and even the first injection, it just typically will make your eye sore. So right now, my eye is definitely, it's not like, right now it's not unbearable, but if I like blink, squeeze hard, like I can definitely tell like it's sore. It has gotten better, but hopefully this won't, gross anybody out, but you can kind of see, I don't even know where I'm looking, this is like all backwards, but yeah, you can kind of see, it's a little bit red. I'm trying to like watch as I do this. They go in, oh, this is all backwards. They go in right there. I don't think there's a mark there, but you can see like the whole eye is like red underneath compared to this one. And I just got this injection done Friday, and there's no spot, no redness. Yeah, my assumption is that it is just from the clamp, betadine, whatever. But I guess we're gonna keep an eye on it and see what happens. So I know I just rambled for like a half hour. That's pretty crazy. So hopefully I didn't bore anybody. But anyways, I kind of wanted to explain a little bit more why I'm doing these streams. Like I said, I've been researching and looking for like groups of people who are my age, around 26 to 30, maybe even younger, that have had, that is going through similar situations. Like I said, I'm going to start documenting everything just through these vlogs. And, even if I could help like one person or even a couple people, maybe just better understand this stuff and maybe, just get through it, that would be great. Like I said, I just kind of want to put the information out there, and because there really isn't much. I've searched, I found a couple channels on YouTube, and like I said, mostly everything was like, due to like retinal detachment, and a lot of things were just like actual medical videos. So, yeah, to my knowledge, this is basically the first, actual macular degeneration vlog on YouTube. So yeah, anyways, obviously, if anybody has any questions about anything, definitely let me know in the comments, or you can contact me directly. I'm pretty sure I have like my contact info on my page. I'm gonna try to do like a video every couple days, maybe like once a week. it's tough to stream. Well, I don't want to say it's tough to stream. It was nice when I was able to stream right from my phone. Just because then like I could do it on the go, like I could take it to the doctor's with me, maybe get some, footage at the actual office. But I guess regardless, yeah, I'm just gonna kind of, post updates just again, to see, see what's up and document this all. So yeah. So anyways, yesterday when I went to the doctor, I have a couple bleeds in my left eye. So right now when I look at the Amsler grid, which is literally just a grid with a black dot in the middle, and it's just it's literally a grid. I have a couple spots like in the upper area. I got the blind spot in the middle, very very small, kinda. I mean, it's noticeable, but it's really only noticeable when I'm looking at words on my phone, or like on a screen or something. But yesterday he checked both eyes, my doctor, and the spots that I'm seeing in my left eye, luckily, hopefully luckily, are just little blood spots. So, I guess the macula and the retina, everything looks good. There's no like fluid buildup, which is not good. But I guess they're just little blood spots, and I guess they could just come and go. The strange thing about this whole macular degeneration, or even like a lot of eye problems in general, every single person is different, and every single case is just so different. There's not like a set in stone, like, oh, you're gonna get this, this, or this, or this. It could literally happen at any, spot in your eye, like this or that. You can have this bleed, that bleed. Like, everybody is different. There's not one similar situation. So, even with like the injections, there's 3 different medications they use: Avastin, which is what I'm getting, Lucentis, and Eylea, I believe. So I don't know. I mean, they're all anti-VEGF medications. Maybe some work differently than others. I don't really know, but I know Avastin is supposedly the most common. I think because it's the cheapest as well. But they all do like similar stuff. So yeah, I guess this is a very tough thing to deal with. But the thing that I gotta try to keep in mind, and anybody else who is dealing with this should definitely keep in mind, there is so much research going on right now, and I guarantee in the next maybe even year or two, there's going to be something new. I know stem cell research is like very very huge, and I think they're almost ready to like roll that out. Basically, they plant stem cells in the back of the eye to regrow the retina. Like, that would just be incredible. So, let me see. I think I got the chat up here. Yeah, I just want to make sure. I don't know. I think there's only one person watching this. That's probably me. It probably counts me. I don't know. But, yeah, yeah, so there's tons of research going on. So, the way I'm trying to look at it, and, trying to, if anyone can think this way, basically just, I guess, don't give up hope, and, if for some reason for you, or anyone or me or anybody, just if shit hits the fan, you gotta realize that there will be, a cure soon, someday. So what I've been doing, literally every time like I get a new spot, it sets me back so much further. Because it's nerve-wracking. Your vision is your main function. It's so close to your conscious, like, it's just right there. So wherever you look, obviously, you can't avoid it. If you got a broken arm or a broken leg or something else, like on another part of your body, like a broken arm probably sucks, probably a lot of pain, but you just, you don't move it. You don't move your arm, and, not saying that's going to be better. I mean, it's, I'm not really comparing issues, but it's just, with your eyes, it's very, it's right close to your brain. So, sorry, I keep looking over here. I'm just trying to check, see if, make sure everything's running smoothly. So I've been streaming for like 30 minutes here. I don't know. I think there's only one. Yeah, I think there's only one person watching this. But I'm hoping that if I continue to do these streams, hopefully, maybe some of you, who are, like I said, going through similar situations can join these streams and, maybe learn some information. We can help each other, I originally used this channel obviously for like music stuff, which is like, you know, my big thing, but I took a break from posting music. I'm still working on music, just not at the pace that I was. I'm just trying to take it easy and spend time with my son and just, you know, just trying to process this all. Obviously music is a good distraction, but I've been kind of here and there actually live streaming on Twitch. I've been doing some gaming, but I'm just trying to keep my mind busy, you know, yeah, all that fun stuff. So I'm hoping, let me see here, yeah. So yeah, I don't know, I'm trying to think of what else to mention here. So yeah, I guess you know, I'll say a couple more things here. You know, like I said, if you are new to this disease or like this eye problem and you do have to get eye injections, it sounds horrible, but it's not that bad. It really isn't. The first injection sucks, like I said. Maybe not for everybody. It's just the aftermath sucks because, again, I mean, a needle is going into your eye. You got to remember, your eye is getting clamped open. Which, I mean, I know they do it for, like, laser eye surgery and a lot of other things, but, I mean, if you've never had that done before, I mean, trauma to your eye, you know, it's gonna be, you know, sore. The way I look at it kind of is like if you lift weights, you know, if you go to the gym for, like, the first time in, like, you know, ever, or even, like, the first time in a couple of years, let's just say, and you get a good workout, your muscles are going to be extremely sore the next day because it's foreign. You know, you've never had that experience, and your muscles eventually, every time you go, they won't be sore anymore. So that's the kind of way I look at it. Obviously your eyes are muscles, your eyelids are muscles, you know, so it's just kind of like similar thing. So yeah, if you do got to get the injections, you know, it's really, you know, it's not a huge deal. It really isn't. You know, I know a lot of doctors have different procedures. I've heard of some people, instead of numbing drops, they actually get a shot in the eye. I don't know. I've never, you know, again, my doctor does numbing gel, so I guess if you are not good with needles and stuff, you know, I guess you can maybe always ask your doctor if they have the numbing gel or whatever. And as far as like the betadine goes, that was another thing. That's like the cleaning stuff they use in the eye. A lot of people have a reaction to that, like just burning. What I've been doing every time I go there, you know, usually like the assistant will prep me, and then the doctor will come in and just boom, do a shot, and that's it. But if you basically, you know, make sure they clean the eye super good afterwards. I'm sure they just use like some saline solution or something, but I never leave, you know, I always ask the assistant, usually the same girl, but she just, you know, I always say, hey, can you just clean my eye super good to get all that betadine and crap out of there, and, you know, everything's been good. So I know the first injection, they didn't clean it that good, and not only did, you know, it was the first injection, so the trauma to my eye, you know, just was very sore, but there was also betadine, so it was just, my eye was super red, you know, and, you know, it was, you know, just kind of sucked. But every single injection is going to be different. Another thing that can happen, which is no big deal, are air bubbles. The first 3 injections, I was fine, or the first 2 injections, I think I was fine. Yeah, and then the third one, I got an air bubble, which is literally just from, you know, the syringe. I don't know really why. I don't think the doctor loads the syringe, so I think it's just a matter of like how quick he pushes it, or if there just happens to be an air bubble in the syringe. So if you know, get the injection and you see like a black disc floating around, like literally it goes crazy. That's just an air bubble, and they usually dissipate in like a day. I've had them the last couple injections, and honestly, it's annoying at first, but it seems to, like, you know, I think because the air bubble obviously rises to the top of your eye, so it'll show up in the bottom of your vision. I'm not going to get into the science of that, but basically it'll dissipate in like a day, so you don't got to worry about that, you know. Another thing too, if you get the injections, usually the eye is like very cloudy, kind of like your vision might be cloudy for a couple hours, but that usually dissipates as well. I mean, you can see the medication kind of going in. Sometimes you can see the medication swirl around a little bit, but that all dissipates. The big thing is obviously just, you know, trying to keep your eye clean. Try not to touch it with like dirty fingers, because you obviously don't want to get an infection. But other than that, I mean, you know, it's really not that bad, and, you know, so far, you know, I mean, I can still drive. I can still see. You know, my vision hasn't changed too much, at least in my right eye. I think I can read like the bottom line, which is pretty good. I think I got 20/20 in this eye. You know, even at the eye doctors when they upped my script, these things are like 10 years old. When they upped it a little bit, you know, I was still able to see like the bottom line. With my left eye, unfortunately, I can't see the bottom line. It's very tough. I had to kind of look to the side of everything. But after that, you know, I can still kind of see. I think I got like 20/50 or 20/60 in this eye, and then I got 20/20 in this eye. So you know, I guess, you know, I will keep everyone posted and updated. I feel like I rambled on a very long time about just, you know, hopefully I didn't ramble about nothing. Hopefully you guys can get some helpful information out of this if you do need it. You know, if you do want to stay up to date on everything, like I said, I will try to post, you know, every couple days, maybe like once a week, just to kind of give you guys progress points and everything, and just to, you know, kind of touch base and show you guys how, you know, everything's going. You know, like I said, if you are dealing or know someone that's dealing with a similar situation, you know, do not hesitate to, you know, ask questions, hit me up. You can either do it on YouTube. That'd probably be the easiest way. You could add me on Facebook, Brandon Chakowski. Yeah, I mean, you could add me on Facebook if you want to, you know, chat. You know, you want any information. You know, you need help with something. You know, definitely let me know. Yeah, just know that, you know, there will be a cure someday, hopefully soon. And, you know, the injections do help, you know. So, I know like 15 years ago they didn't have injections, so people who got this, I think they had like a laser treatment. But the thing with laser treatment is that it's very invasive, and it left scarring, so you were left with like permanent damage. Luckily the injections came out, and like I said, I've been kind of Googling some stuff, and they are working on tons of just new medications, new injections. I've seen something about like eye drops, anti-VEGF eye drops. That would be like crazy, because then you don't have to get the injections and patients can do the drops themselves. So I know that's something that's almost in phase 4, I believe. I think it's in phase 3 right now. I did link up, I talked to someone on Facebook in a group I'm part of that also said that he's going to be, I think, part of like some study at Will's Eye. I don't know. I think that's like a hospital, like Will Eye Hospital or something. I don't know what the full name is, but I guess there's like some new long-acting medication. Instead of getting a shot every 4 weeks, it would be like every couple months. So, you know, there's so many different things that they are working on. I mean, you know, there's something going to be, you know, something soon. You know, like I said, I kind of have faith in the stem cell research, and, you know, I feel like that's going to be a big thing soon. I mean, so many people are affected by this, and not necessarily like a lot of, maybe there are a lot of young people, I don't know. But like I said, I'm super nearsighted, and normally the only time you would get this if you are young, like my age, is if you are nearsighted. I know diabetics can get eye issues similar to this. I've heard of people actually like younger than me. I think I heard of like a 13-year-old that got this. But I guess it was like due to some fluid in the brain, possibly. I don't know the whole story, but they were able to fix it, thank God, and, you know, I guess he's fine. So, you know, yeah, that's, I guess, you know, that's all I kind of got. You know, I feel like there was a lot more I kind of wanted to talk about, but, you know, I've been going for 40 minutes already, and, you know, I guess the reason, too, I'm live streaming, because I'm lazy and I don't feel like recording a video and then uploading it. The cool thing about live streaming on YouTube, which is why I like to do it from my phone normally, is because after you're done live streaming, it posts right to your page like that. And something like this, I don't really care about editing. I just want straight information out there. So, you know, and live streaming too, you know, hopefully if I do this more often, more people will join and, you know, interact and hopefully ask questions and stuff. And like I said, just, you know, hopefully this will help anybody get through it. But yeah, the next live stream I do, or the next video I post, won't be just a bunch of rambling. You know, I'll kind of just, you know, do updates and stuff. And yeah, so yeah, my eye is pretty sore right now. And the best thing I can do, the best thing I've been doing is just taking ibuprofen. It definitely helps. Try to stay away from like aspirin or like blood thinners, I believe, just because it could. I don't know if it would necessarily make it worse, but you just don't want to take blood thinners, I guess, with this. I kind of was like worried about drinking coffee because I've been drinking coffee every day for like the last 10 years. Pretty much my whole life I've been drinking coffee, and I always worry about it, but I talked to a couple people, and I guess coffee is fine to drink. It doesn't affect anything, luckily. So, another thing too, that's what I wanted to mention. Vitamins. I do believe in like vitamins and eating healthy and stuff. I personally haven't really eaten healthy. I just stopped smoking last year. I stopped vaping last year, which was the best thing I could have done. I've always been around nicotine and smoking, and I've always I chewed tobacco, then I smoked cigarettes, and then I vaped, and that is right off the bat, that's just bad for you, obviously for many reasons, but it can also affect your eyes, so, if you do have these issues, definitely stopping smoking would be like the biggest thing to do. But I've been taking, because I can't swallow pills really. Like I almost choked on a pill like a couple years ago, and it's still implanted in my brain. So like I can't swallow pills. So I got gummy vitamins, but they do have gummy Bausch and Lomb. I should have grabbed it, but it's Bausch and Lomb. It's got lutein and some Z word. It's basically in most of the eye vitamins. But yeah, they're just gummy vitamins, and you take them, once a day. And, whether they help or not, I don't know, but it's still just that reassurance. Also, like omega-3s fish oil, that's like something good to do. Do some research. I'm pretty sure fish oil in high doses is like a blood thinner, so you gotta be careful with it, don't take too much. But supposedly that, helps. And another thing I've also been doing, I've been trying to like eat a little healthier. Another thing this is something that I am going to try like more steadily. I did like a couple weeks ago for a couple days. I tried it, but it just I stopped just for whatever reason. But CBD oil. I know like that's like that's like a big craze right now, and like everyone's using it for everything. And I'm pretty sure now it's like legal everywhere, or close to, or I mean CBD I think technically isn't illegal, but like if you get like the real stuff with like THC, obviously I think you need like a card for it or something, and it's like not legal. I don't know I'm not into that, like I don't follow that, the whole everything with the medical marijuana and all that shit, but I do have some like actual CBD oil, and like it's the legitimate stuff. It doesn't have like THC in it, but it's legit from like an actual place, not just like some head shop. But I've heard that CBD oil has tons of antioxidants in it. I said that weird, antioxidants. And it also has like some just like a whole bunch of long words. But supposedly, it's not necessarily going to cure the eye, but it could help slow the progression. Or at least help protect the retina. I totally forgot that they actually used to use medical marijuana, or maybe they still do for, I think, glaucoma, I believe, which is high pressure in the eye. I don't know the symptoms, but they use that for, eye problems. Too much of, anything, I guess. But too much, CBD or THC, I guess, could cause an increase in pressure in your eye, so you gotta be careful. But I'm pretty sure, like small doses, I'm going to do a little experiment. I'm going to take it, obviously I'm probably not going to notice like a huge difference. It could be a coincidence, if it does work, if it doesn't, I don't know. But I'm going to start doing that. I'm going to start taking like a small dose every day to see if it, if I notice any improvement. I will definitely post back to you on that. If anyone has any input on that, like I said, because I'm not really that well, I don't know a lot about that stuff, so if anyone else has any experiences with that, with eye problems, definitely let me know. And, other than that, that's kind of all I got for you guys today, so hopefully, this will be a start to something. Like I said, I'm going to try to do, like, these vlogs, maybe, like, once a week. Maybe anytime I notice a change, or for better or worse. I don't know. I just kind of, I'm gonna wing it and see how it goes. I was gonna make a new channel for these videos because it doesn't really fit with music, but truthfully, I don't really care. I really don't have many subscribers anyways. I think I got like 30. So, hopefully, this will get out there, and, maybe it'll just, help someone. And, like I said, if you do want to stay up to date, or you do have any questions, please let me know. And, yeah, if you could please subscribe to my channel if you do want to, stay up to date on this stuff, or leave a comment. If you did enjoy this video and it did help you and you learned something, maybe I didn't really teach much, but if this video helped you in any way, hit that thumbs up button. Let me know what I could, let me know how I can improve, or let me know just any questions, any comments, anything. Just let me know. And then other than that, yeah, I thank you for anyone that tuned in, and yeah, I'll see you guys next time. So peace. Now I gotta find out how to end this stream. Thank you for anyone that tuned in, and yeah, I'll see you guys next time. So peace.